Welcome back to the Deep Dive. Today we're going to be diving into a topic that, a lot of men deal with but don't often talk about,
Right.
premature ejaculation, or PE as it's
Yeah.
known.
Yeah.
Um, and it might surprise you to know that it's actually way more common than most people realize.
Absolutely.
But, there's a ton of myths and misunderstandings surrounding PE.
Definitely.
So we're really here today to hopefully unpack some interesting research and encourage, some more open conversation around it.
Yeah, absolutely.
We've got three really cool sources that we're going to be diving into today.
Okay.
The first is a 2024 academic journal article that compares international guidelines on PE from organizations like the European Association of Urology,
Mm-hmm.
the American Urological Association, and the International Society of Sexual Medicine.
That's great.
Um, and it's really interesting how these guidelines, while all addressing PE, they actually kind of differ in their definitions and approaches.
Yeah, they do. It really highlights the complexity of this issue and the lack of sort of one singular definition.
Yeah, and so that's something we're going to kind of unpack today.
For sure.
We've also got a 2023 news piece that focuses on some promising non-pharmacological treatments for PE.
Okay.
So think lifestyle changes rather than medication.
Interesting.
Yeah, it's really cool.
Yeah.
And then finally, we'll be looking at a 2024 narrative review that dives into the relationship between PE and erectile dysfunction, or ED.
Gotcha.
So our mission today is really to kind of move beyond those simple definitions.
Yeah.
We're going to explore the varied causes of PE, debunk some myths, and highlight why seeking professional help is just so crucial.
Absolutely. I think a lot of men feel like they're alone in this, and so being able to talk about it and get information is really important.
Totally. And with the right information and support, PE is a manageable condition for most men.
Definitely. Yeah.
Okay, let's unpack this.
Let's do it.
One of the things that really stood out to me was how even defining PE is not as straightforward as you might think.
You really think it would be?
Right.
Like, oh, I know it when I see it, but it's not.
It's not that simple.
No.
And that's one of the key takeaways from that journal article,
Right.
comparing those international guidelines.
Exactly.
You've got organizations like the European Association of Urology, so the EAU.
Yeah.
You've got the American Urological Association and the Society of Men's Sexual Health, or AUASMSNA, and then the International Society of Sexual Medicine.
ISSS.
They all have like slightly different takes on what actually constitutes PE.
Right. And I think that's a really good point for people to take away, right? Like, it's not so simple. It's not black and white.
That's
There's
it.
some nuance here.
So it's not as simple as everyone agreeing on one definition.
Not at all.
Okay.
Most definitions include these core elements.
Hmm.
Ejaculation happening sooner than desired, a lack of control over the timing,
Right.
and feelings of distress or frustration.
Makes sense.
But even the types of PE that they describe can vary.
Okay, like what? Give me an example.
So, for example, some guidelines differentiate between lifelong PE, meaning it's been present since a man became sexually active,
Okay.
versus acquired PE.
Which develops later on.
Exactly. And then there's also variable PE, where the timing is inconsistent.
Okay.
And then even subjective PE.
Subjective PE, what's that?
This is where it gets interesting. Subjective PE is when a man perceives his ejaculation as premature.
Okay.
Even if the ejaculation latency time, so the time it takes to ejaculate, is actually within a normal range.
So it's not even about the time necessarily, but how he feels about it.
Exactly.
Interesting.
And that highlights the psychological component of PE, which I think is often overlooked.
Yeah, for sure.
We'll dive into that more later, but it's just a reminder that this is a complex issue with both physical and psychological dimensions.
Yeah, and do these differences in definitions have real-world consequences for men who are seeking help?
Absolutely, because a man might be diagnosed with PE based on one set of guidelines, but not another.
Oh, wow.
So it can be really confusing and frustrating.
Totally. And also, it affects research
Yeah.
and how we even understand the prevalence of PE.
Exactly. Yeah.
Speaking of prevalence, there's that often cited statistic that PE affects 20 to 30% of men.
Right.
But our sources suggest that this number might be inflated.
Yeah, both the ISSM and EAU guidelines mention that figure, but they caution that it could be an overestimation,
Okay.
partially because there's a lack of those standardized definitions that we were talking about.
So a man who maybe experiences, just occasional, slightly earlier than desired ejaculation might be lumped in with someone who has lifelong severe PE.
Yeah, exactly. They're
Yeah.
not necessarily experiencing the same thing.
Totally. So it's much more nuanced than just throwing out a single statistic.
For sure.
And our journal article even cites Turkish and Chinese surveys that break down the prevalence by PE subtype, and the numbers kind of paint a different picture.
Yeah, well, lifelong PE, which we talked about, is actually much lower, somewhere around 2 to 3%. But then you look at acquired PE, variable PE, and subjective PE, and the percentages are higher.
Yeah, that makes sense, because it's more common to develop later in life or have more variability.
Right.
Okay, so it's a lot more nuanced than people might think.
It is, yeah. And to complicate things further, the AUA-SMSNA guidelines actually suggest a prevalence under 5%.
Wow. Okay, so that's a big difference.
Huge.
Why is there such a gap there?
Well, one theory is that PE might often occur alongside erectile dysfunction, or ED, and the ED becomes the more prominent issue, so the PE gets masked.
That's really interesting.
Yeah,
Okay, so we're already seeing that PE is much more complex than many people realize.
absolutely, yeah.
And this complexity underscores why it's so important to get accurate information and to seek professional help.
Definitely, if you're experiencing any of these things, you don't have to suffer in silence.
Exactly. Now let's talk about age.
Okay.
There's this common belief that PE fades with time as men get older.
Right,
Makes sense.
logically.
Yeah, you lose sensitivity as you age. Yeah, you would think so.
But the research paints a more complicated picture.
It does.
Some studies show a decrease with age, some show an increase, and some show no change at all.
It's all over the map.
Yeah, it's like, what's going on here?
Well, I think this is where research design is really important.
Okay.
Our 2024 narrative review emphasizes that to truly understand age-related trends,
Yeah.
you need to differentiate between lifelong and acquired PE.
Gotcha.
They likely have different trajectories as men age.
So just lumping all types of PE together makes it harder to get a clear picture.
Absolutely, yeah.
Okay, now let's tackle one of the biggest myths surrounding PE.
Okay.
The idea that it's all in your head, purely psychological.
This one is so damaging.
It is.
And it prevents a lot of men from actually getting help because they think, oh, it's me, it's my fault, I'm the problem.
Right.
And there's this stigma.
Yeah, and it prevents them from talking about it and seeking help. Right, and thankfully, both EAU and ISSM guidelines actually acknowledge a really wide range of potential risk factors.
Okay.
And they go way beyond just your mental state.
So it's not just about thinking happy thoughts.
Yeah. No, it's not as simple as that.
There are actual, like, chemical processes in the brain and other factors at play.
Exactly.
So what are some of those other factors that contribute to PE?
So you've got neurobiological factors like serotonin and dopamine.
Okay.
These are neurotransmitters that play a role in mood and pleasure and ejaculation.
Right.
And when there's a dysregulation in those systems, it can contribute to PE.
So that's why seeking professional help is so important, because if it's a biological issue, there might be medical treatments.
Right, exactly. It's not just about like toughing it out or trying to like will yourself to last longer.
Yeah.
There could be real tangible things that can be done
Exactly.
to address those underlying factors.
It's about empowering men with the knowledge that they don't have to suffer in silence.
Right.
So we've got brain chemistry. What else is there?
You also have genetic predispositions.
Okay.
So some men might be genetically predisposed to PE.
Like any other health condition, right?
Exactly. It's like anything else.
Sometimes there's a genetic component.
Absolutely.
Okay, so we've got brain chemistry, genetics. What else?
Well, hormonal imbalances can also play a role.
Okay.
For example, hyperthyroidism, which is an overactive thyroid gland, has been linked to PE.
Gotcha.
And then you have prostate issues.
Like what?
So things like chronic prostatitis,
Okay.
which is an inflammation of the prostate gland, can also contribute to PE.
So it's really a whole body thing.
It is.
It's not just isolated to one area.
No, it's not.
And then, of course, there's lifestyle factors,
Of course.
which we all know and love.
Right, those always come up.
So, like, what kind of lifestyle factors are we talking about?
So things like obesity, lack of physical activity, smoking, and excessive alcohol consumption.
Those are all the fun ones.
All the good stuff, but they've all been linked to an increased risk of PE.
So making healthy lifestyle choices can not only improve your overall health, but also potentially impact your sexual health.
Absolutely. And this is where that news piece about non-pharmacological treatments comes in.
Right.
It really highlights how making these changes to your lifestyle can actually be a very effective way to manage PE.
And we'll definitely dive into that more a little bit later.
Yeah.
But for now, I think the key takeaway here is that PE isn't just a psychological issue. It's a complex interplay of biological, psychological, and lifestyle factors.
It is.
And that's why seeking professional help is so important, because a healthcare provider can help you identify the root cause of your PE
Mm.
and develop a personalized treatment plan that really addresses your specific needs.
Exactly. It's not one size fits all.
And that brings us to another interesting connection highlighted in our sources, the relationship between PE and erectile dysfunction, or ED.
Yes, that's a good one.
Yeah, so our 2024 narrative review really emphasizes the strong correlation between these two conditions.
These often coexist.
So it's not just that men might experience both PE and ED,
Yeah.
but they might actually influence each other.
Absolutely. It's this vicious cycle.
Explain it to me.
So imagine you're worried about ejaculating too quickly, so you're constantly focusing on controlling it.
Okay.
But that focus and anxiety can actually lead to reduced arousal and difficulty maintaining an erection, which is essentially ED.
So the worry about PE is contributing to the development of ED.
Yes, exactly.
That's fascinating.
And on the flip side, if you're hyper-focused on maintaining an erection, that heightened arousal might worsen PE.
It's like a catch-22.
It is. It's a tricky balancing act.
That sounds incredibly frustrating.
It can be for a lot of men.
And it really does underscore why professional guidance is so important, because just trying to navigate these issues on your own
Right.
can lead to more anxiety and potentially worsen both conditions.
Absolutely.
So what's the takeaway message for our listeners who might be struggling with this?
Don't suffer in silence.
Right.
Reach out to a healthcare professional.
They can help.
They can help untangle this web of physical and psychological factors, address any underlying medical conditions, and help you find a treatment plan that works for you.
It's all about getting the right information and support so you can take control of your sexual health and well-being.
Exactly. You don't have to go through this alone.
Okay, so we've talked about defining PE, the prevalence, the age factor, some of the causes. Now let's move on to diagnosis and treatment options.
Sounds good.
We'll be right back after a quick break to dive into that in more detail.
See you soon. So how do healthcare professionals actually go about diagnosing PE? It's more than just, a quick question about how long you last in bed.
Yeah, I was kind of wondering about that because I was imagining, like, are they using stopwatches or, like, what's going on there?
Not quite. All three of the organizations we've been talking about, the EAU, AAS, MSNA, and ISSM, they all really stress the importance of a thorough medical and sexual history as that first step.
So it's about getting the bigger picture of the man's sexual health,
Exactly.
not just focusing on one specific symptom.
Right. A healthcare provider is going to want to know about a man's overall sexual function.
Yeah.
Any history of psychological or emotional issues.
Makes sense.
And any potential medical factors that could be contributing to the problem.
So it's like trying to fix a leaky faucet without checking the pipes.
Exactly.
You might stop the drip temporarily,
Yeah.
but that underlying problem's still there.
That's a great analogy.
And here's something I thought was really interesting. The EAU guidelines actually recommend including the partner in the psychological assessment.
Yes, that's a good point.
Why is that?
Well, they recognize that PE impacts both individuals in a relationship.
Right.
And involving the partner can actually provide really valuable insights into the dynamics at play,
Okay.
the emotional impact of PE,
Makes sense.
and the best ways to approach treatment together as a team.
It's a good reminder that communication and support are so important in these situations.
They really are.
Okay, so we've got the medical history, the sexual history, the partner's perspective.
Mhm.
What else is involved in the diagnostic process?
Well, all the guidelines agree that a physical examination is also a key component.
Okay.
This helps rule out any anatomical abnormalities or underlying medical conditions that might be contributing.
So if a man develops PE later in life after previously having normal ejaculatory function,
Yeah.
is that a red flag?
It can be, yeah.
That something else might be going on?
Yeah, it could be a sign of a prostate issue,
Okay.
a hormonal imbalance, or even a neurological condition.
It all ties back to what we were discussing earlier about PE not being just a psychological issue.
Right.
There could be real physical reasons behind it.
Absolutely.
Okay, so in addition to the history and the physical exam, healthcare providers might also use validated questionnaires
They might, yeah.
to gather more information and assess the severity.
Exactly.
Our journal article mentioned a few, like the Premature Ejaculation Diagnostic Tool, or PET, the Arabic Index of Premature Ejaculation, and the Premature Ejaculation Profile, or PEP.
Yeah.
I gotta say, those names aren't exactly catchy,
No, not really.
but I guess they're more about function than flair.
I think so, yeah.
But these questionnaires, They delve deeper into various aspects of PE, like ejaculatory control,
Yeah.
distress levels, the impact on the man's relationships, and quality of life.
Exactly. So they're really trying to get a comprehensive picture of what's going on.
So they provide a more standardized and quantifiable measure of the issue,
Right.
rather than just relying on subjective descriptions.
Exactly. And I think having that objective data can be really helpful
Yeah.
in developing a tailored treatment plan.
Okay, now here's the question I'm sure a lot of people are thinking.
Okay.
Do all men with PE need medication?
Not necessarily. The best course of treatment really depends on a number of factors,
Okay.
including the severity of the PE, the underlying causes, the man's overall health, and his personal preferences.
So it's not one size fits all.
No, definitely not. And remember that news piece we talked about with the non-pharmacological treatments?
Mm-hmm.
Exercise, particularly running and pelvic floor exercises, can have a really positive impact on PE.
And those studies were pretty impressive, some of them showing exercise to be just as effective as medication, but without the side effects.
It's true. It's pretty amazing what some simple lifestyle changes can achieve.
That is amazing. What about psychological and behavioral therapies? I know we mentioned those earlier.
Those can also be incredibly effective both on their own and when used alongside medication.
So it seems like finding the right treatment path is really about having that open and honest conversation with your healthcare provider,
Yeah.
exploring all the options,
Exactly.
and being open to trying different approaches.
That's the key.
And one of the most important things that healthcare provider can do is help that man understand that he's not alone in this.
I think that's so crucial.
PE is a common condition, and there's no shame in seeking help.
There really isn't. We need to break down the stigma.
Totally. Let's talk a bit more about those non-pharmacological treatments.
Okay.
We touched on exercise earlier. Are there other lifestyle changes that can make a difference?
Yeah, absolutely.
Uh,
One of the biggest things is addressing stress and anxiety.
Okay.
We talked about how those psychological factors can really exacerbate PE.
Right.
So finding healthy ways to manage stress is crucial.
So it's not just about what's happening in the bedroom. It's about taking care of your overall mental health.
Exactly. Mind and body are connected.
Sure.
Another important factor is sleep.
Sleep.
When you're sleep deprived, your body produces more of the stress hormone cortisol,
Okay.
and that can interfere with sexual function.
So getting enough sleep is good for your sex life. Who knew?
It really is. It makes a difference.
And then there's diet.
Of course.
We got to talk about diet.
Gotta talk about diet. Eating a healthy, balanced diet can improve circulation and hormone balance, both of which are important for sexual health.
Okay. So it really does all come back to those foundational pillars of health.
It really does.
Managing your stress, getting enough sleep, and eating well.
Those are the key ingredients.
And of course, not smoking.
Right. And not drinking too much alcohol because those can actually worsen PE.
So kicking those habits could have a double benefit,
Absolutely.
improving overall health and potentially your sexual function as well.
Exactly. It's all connected.
Let's go back to the news piece about exercise.
Yeah, let's do it.
Those studies they highlighted show that both aerobic exercise, like running,
Yeah.
and pelvic floor exercises
Yeah.
can have a significant impact on PE.
Yeah, I think those pelvic floor exercises are especially interesting because they're really targeted.
Yeah, they're discrete.
Exactly. You can do them anywhere and nobody knows what you're doing.
Exactly, so no one has to know that you're doing your PE workout at your desk.
I love it.
Okay, so we've got stress management, sleep, diet, exercise.
Yep.
Are there any other lifestyle changes that might be helpful?
There's some evidence to suggest that certain supplements might be beneficial,
Okay.
although we need more research on this. For example, some studies have shown that zinc and magnesium supplements might have a positive impact on ejaculatory control.
So it's worth talking to a healthcare provider about those options as well.
For sure, they can help you determine if supplements are right for you
Okay.
and make sure that you're taking them safely and effectively.
Okay, so we've covered a lot of ground here.
We have.
We've talked about diagnosis, we've talked about lifestyle changes, and we've touched on medication and therapy.
Yes.
But I want to emphasize again that there's no one-size-fits-all approach to treating PE.
Absolutely not. What works for one man might not work for another. It's about finding the right combination of treatments that address the underlying causes and meet the individual's needs.
And that's where having a healthcare provider that you trust and feel comfortable with is so important.
It makes all the difference.
Before we move on to the final part of our deep dive, I want to circle back to those myths and misconceptions about PE.
Okay, sure.
We talked about how harmful the myth of it being all in your head can be, but what are some of the other misconceptions that you encounter in your work?
Well, One common misconception is that PE is only a problem for young men.
Okay.
But as we've seen, acquired PE can develop later in life.
Right.
And men of all ages can be affected by this.
So age is not a barrier to seeking help.
No, not at all.
Okay.
Another misconception is that PE is a sign of weakness or lack of masculinity.
Oh, gosh, yeah.
But it's a complex medical condition with a variety of underlying causes.
It's about time we stop attaching those outdated and, frankly, harmful notions to sexual health issues.
I completely agree.
And then there's this misconception that PE can't be treated,
Right. But as we've seen today, there are so many effective treatment options available.
both pharmacological and non-pharmacological.
Exactly. There's hope.
So the message here is, if you're struggling with PE, don't give up.
Absolutely.
Reach out to a healthcare professional, explore your options, and take control of your sexual health.
You're not alone in this.
Yeah, there are people who understand and want to help. All right, we'll be back in a moment to wrap up our deep dive into premature ejaculation with some final thoughts.
Sounds good.
We've covered a lot of ground today,
We have.
from those complex definitions of PE to, its causes and the latest research on treatments.
Absolutely.
And I think, one of the most important takeaways is that PE is not something to be ashamed of.
Yeah. No, not at all.
It's a common medical condition,
It is.
and help is available.
There is, for sure.
Seeking help is a sign of strength, not weakness.
Absolutely.
And, it's the first step towards taking control of your sexual health and improving your overall well-being.
Totally agree.
So as we wrap up this deep dive,
Yeah.
I want to leave our listeners with a question to kind of ponder.
Okay.
We've seen how promising exercise can be in treating PE,
Right.
often with similar effectiveness as medication,
Yeah.
but without those potential side effects.
It's amazing.
It really is.
You know those studies on running and pelvic floor exercises? They're pretty eye-opening.
They are. It makes you wonder,
Makes you wonder if lifestyle changes could become a more central part of treatment approaches for PE in the future.
yeah, that's a really interesting thought.
It is.
Because right now, exercise seems to be viewed as more of a supplemental therapy,
Right.
something you do in addition to medication or therapy.
Exactly.
But what if it became the foundation of a more holistic approach?
Imagine that, like healthcare professionals routinely prescribing individualized exercise plans as a first-line treatment for PE
Wow.
alongside, other therapies as needed.
That would be a real paradigm shift in how we view and address PE.
It would, absolutely.
And it's not just about the physical benefits.
Right.
We know that, regular physical activity has a huge impact on mental health.
Huge.
Reduces stress, reduces anxiety, even symptoms of depression.
For sure, and we know those psychological factors can play a big role in PE, so
Right.
it's like a win-win.
And it empowers men to kind of take an active role in managing their condition.
Right, not just relying solely on medication or those external interventions.
It shifts the focus from fixing a problem to proactively building well-being, right?
I love that.
It's about creating these healthy habits that support both physical and sexual health.
That's a great way to put it. It's a proactive approach to sexual well-being rather than a reactive one.
Exactly.
Love it.
So as we wrap up our deep dive, we encourage you to think about this.
Yeah.
What if exercise was the cornerstone of PE treatment?
I think it's a question that deserves, further research and discussion and exploration.
Absolutely. And remember, if you're struggling with PE, don't hesitate to reach out for help.
Please do.
There are healthcare professionals out there who are knowledgeable and compassionate,
Yes.
and they're ready to guide you on a path towards better sexual health and overall well-being.
You are not alone on this journey.
Thanks for joining us on the Deep Dive.
It's been great.
Until next time, keep diving deeper into this fascinating world of knowledge.
Absolutely.